If you take away the silos of medicine, inflammation at its most naked, vulnerable point is what really creates and causes virtually all disease states. And if that is a root cause, let us acknowledge that.
Right.
Why can't we acknowledge it? Why do we have to silo it?
What if the key to transformation lies in shifting your perspective? Hi, I'm Dr. Payal Beri. Welcome to Reframing Perspectives. Every conversation here is about one thing: how empathy changes the way we lead, connect, and create impact. Each episode, we get to explore deep, authentic conversations designed to expand your mindset. Whether you're looking to transform your leadership, deepen your relationships within your circle, your community, and friends, or gain clarity in your own personal growth, each episode will inspire you to see things differently and take action. If you're ready to challenge your thinking and embrace transformation, you're in the right place. Let's dive in. So I have multiple chronic and autoimmune illnesses, and this is something I've been dealing with since I was 17 that I was aware of, but even though it probably started a lot sooner, I just wasn't aware of it as much, right? So I've been dealing with these issues for almost 30 years, and it has been a journey, right? Anyone out there who deals with autoimmune issues, who has chronic illnesses, you know the frustration, the stressors, and just the triggers and the PTSD that comes with dealing with the medical system here in the US and just in general. And what was really beautiful about the conversation that I got to have today with Dr. Jaclyn Tolentino, one, she was actually a former doctor of mine, integrative functional medicine doctor, who is just filled with compassion and really talks about, what it means to look at any illnesses or any kind of medical conditions that you may have and really practicing a holistic and a whole body approach to get to the root of these issues, right? And to really understand what it means to optimize your health, looking at every angle of your life and not to just compartmentalize it from one perspective. And we dive into just what that experience was for her as, having breast cancer in her early 30s and seeing her mom have had breast cancer and just what that means in her journey with, being able to become a mom and what that really looked like in her being able to really dive in deep into disease prevention, longevity, and all the things that we're now really starting to embrace. So today was a really intimate conversation of her own personal experience, my experience, and just really the future of medicine. So I hope you really enjoyed this conversation because she is incredible. Welcome. I'm so excited to have you, not just as a guest, but my former doctor as well, who was honestly one of my first doctors that put me on the track of functional health and looking at my body in a different way than I would have ever considered. So I'm so excited to have you on and to just really hear your journey and why functional and integrated medicine is so important to you.
Thank you. I'm really excited to be here with you today.
Yeah. So I want to first just kind of get started with your journey even into medicine. Your journey into starting with the fact that your mom was diagnosed with breast cancer at a very young age when you were 8. And then later you had breast cancer as well. And so what was that from a very young age when your mom had it? What about that stuck with you to take this journey?
Yeah. So when I was little, I remember my mom going to the hospital and just saying, I had the flu, I'm feeling sick. And I'm the youngest of 3. She didn't want to put that burden on me, especially at that age, to, understand it at that level. But as I got older and as I realized what happened, of course, I guess subconsciously, intuitively, that really did stuck with me. When I was in college, I did a bachelor in health sciences, and normally in that track, people typically go physical therapy, occupational therapy, nursing, or even medicine. And even then, I still felt underneath it that this was something that I wanted to do, but I wasn't quite sure if I was just ready for that path of college straight into medical school and beyond. So my mom told me that when I graduated college, figure out what you want to do and learn to explore a little bit. So I moved to Naples, Florida. My older brother is about 10 years older than me, and he's an attorney. And he said, you know what, Jack, why don't you come and live with me? And over the summer, I'll help you get a job at a doctor's office. And I said, cool, that might be my first step into if this is something I want to do. We went into the doctor's office and he went ahead and like helped me apply. I ended up working for an osteopathic doctor who was fresh out of his residency. And as a DO, I'm not sure how familiar you are with osteopathic medicine, but we really focus on the body's innate ability to heal itself and the fact that all of the body systems are interconnected. Yeah. And that really spoke to me. So when I was working for him, I was literally the front desk girl, helping with prior authorizations, doing some light medical assistant work, and kind of like doing a lot. But what I loved was seeing how he interacted with the patients. I loved seeing how he saw whole families. I loved that all of his patients were really excited and inspired to see him each time. It wasn't just trucking themselves into the doctor's office. And this is way back, right? Like several years ago. And then I told him, I said, I love what I'm doing. I love my job, but I want to do what you're doing. And he said, well, great. Like you did your Bachelor of Health Sciences. You already completed the requisition, like the requirements. Mm-hmm. So you just need to take your MCAT. Mm-hmm. So he gave me a couple months off from that particular job. I studied for the MCAT. I took it, and the rest was history from there. I didn't even apply to allopathic schools, MD schools. I specifically chose osteopathic schools because of his mentorship, his guidance, and seeing how his interactions were with the patients. And also just the philosophy, I really embraced that, the idea of the interconnectedness of the body systems and how your body can heal itself. So that was quite an experience, right? You go from being the girl at the front desk, answering the calls and checking people in, and then just realizing, okay, there's so much more that I want to be able to offer, and I could see myself doing it the way that he was. Yeah. My mom, she loved that for me. She was, of course, like, wow, this is exciting that this is something that you want to do. But then again, she also realized that from a health perspective, there was so much at that point of time. This is Jacqueline, like in college, that she wanted to be present for, that she wanted to help guide me with. And my mom was older when she had me. She was roughly around 40. Mm-hmm. And that was first cancer. Her second cancer was around the age of 68. Wow. And then now in her third, she's got metastatic breast, and she is now 82. Wow. So, talk about an inspiration for me. Somebody who I've been in my own breast cancer journey with, and at the same time, we oddly enough, share this experience together. We also share the healing journey together. Yeah. We share everything that I learn together. So my mom is pretty much not only that mentor and that person who's inspiring me, but also somebody who just helps keep the light on for me to keep going and doing what I do.
That's so beautiful. I think, I'm a big believer that nothing happens in coincidence. And, for you to be on this journey, for your mom to have gone through it 3 times now, and for your own journey, it's almost like that preparation for even how you're going to move through when, you had it. Something that I find always really interesting. So me having multiple health issues, right? Hashimoto's, diabetic, and now high cholesterol that runs in the family, all the things. Great stuff. Yeah. I won the lottery. But one of the biggest frustrating points has always been that you go to an endocrinologist for this, then you go to a cardiologist for this, then you go to this person for this, and no one is talking to each other. And, obviously the body's a complicated system, so we need to have specialists and make sense for all of that. But, I look at that, and I look at that as like a broken part of the education system, that why aren't doctors taught to look at things from a more holistic place? And also, like, why isn't nutrition a bigger part of the medical journey? I have friends that are phenomenal doctors who I would trust myself with 100%, but they do follow that traditional path. What would you say that, like, if you could change that educational system for doctors to become more open to seeing the body and the way it works, like, what would that be?
Yeah, I mean, if I had a magic wand, every doctor would look at life and health and healing in that way. Yeah. The medical system traditionally was designed to create these silos. And I think that the more and more that we're becoming curious as human beings, and also as physicians who have also felt the impact of being burnt out and overtaxed in these silos of practice of medicine, we're all reevaluating how we want to practice, how we want to live, how we want to heal people, how we want to support ourselves. And within that reevaluation, we're also questioning, we're becoming more curious. We're seeking additional alternative means of education beyond the traditional scope because we realize that this isn't working.
Yeah.
There are absolutely, don't get me wrong, there are certain aspects of healthcare today that I absolutely value and I'm grateful for. For example, if acute care medicine, you walk into ER, something is acutely going wrong, but the chronic disease epidemic is very real. You mentioned just like the medical conditions that you're experiencing, even what I'm experiencing, we're questioning if this is it to healthcare. Is there more? And also from a clinician standpoint, can providers offer more? Can we as doctors offer more? And it goes back to that traditional scope of the way that we were trained and, the limiting education in certain aspects of health that are absolutely crucial, including lifestyle medicine, that I find to be so valuable. And it's hard, I think, as a doctor. It's really hard, especially for my colleagues that are within that space that maybe they're not happy there.
Yeah.
And they want to get out and they want to practice more open-minded, but maybe they're limited on administration time. They don't have enough time with patients. They have 20 to 30 people per day. They are, in this rat race that they don't want to be in. And so I do really feel for them. And, for the ones that want to get out, that have that curiosity to say, you know what, I think I need a different path for myself, thankfully there are options. There are options of different ways to practice, of different ways to heal. And the more open-minded we are to recognizing that at the end of the day, all of us as physicians, we all want the same. We want to heal and support people. And I think that's where the movement and the paradigm shift needs to go. Yeah. And over the past couple of years, you're already seeing it shift that way. Especially here in the West Coast, we see a lot more patients that are open-minded to outside of traditional means. Right. And maybe they would have a primary doctor that they might be seeing once a year, but they also recognize that that doctor might only have 10 to 15 minutes once a year, and that's the extent to what they can offer them. And when they go outside the box to see these other clinicians who have an hour or two, who have access to messaging, to help brainstorm, to help collaborate, to really focus on that, it's a very different kind of care. Yeah. So somewhere along the lines, this paradigm shift, especially for the chronic disease population, needs to shift more towards this open-minded and wholehearted way of thinking, where we are accepting of all of these different types of philosophies to support healing and working together. And I think that's also something that we really value at Love.Life. That's why I kind of switched gears and really excited about this opportunity, because instead of it being siloed medicine, it is a more collaborative effort. And we have more than 20 experts in-house, so we are all working on our patient care collaboratively, not in silos anymore. Yeah. The interesting thing is when you learn about functional and integrative medicine, there are certain aspects of cardiology, of endocrinology, of pulmonology, et cetera, that you can support, right? And I don't think that it's woo-woo.
Yeah,
don't.
That part right there is that these are things that have existed for thousands of years. And
Yes.
if anything, correct me if I'm wrong, but if anything, Western science studies that in order to then convert that medicine into a pill that can ultimately serve. So you're studying the ancient practices in order to get modern medicine.
It happens time and time again.
Yeah.
That it's like that. And I think what's frustrating is that instead of there being a divide, there are doctors that are very much against this outside way of thinking. Why does it have to be?
And what is, I was actually going to ask you that question, is that, what is it about this like resistance to the woo-woo, right? Or like calling it that, because the woo-woo automatically means that I'm going to dismiss anything that you're doing.
Right.
You're now, I've heard this from others, those more traditional doctors being like, the minute a patient comes in and says that they want to do this integrative, I actually drop them as a patient because I don't have any desire to, do things that are not science-backed.
Yeah. I can tell you from my own personal experience, that's how I can speak to it. Mm-hmm. When I was in my early 30s, right before the breast cancer, I was a concierge doctor practicing in Miami Beach. Mm-hmm. I was seeing 20, 30 people a day, 5 days a week. Let's do the math. That's a lot of patients. I was also working on the weekends, working during holidays, busting my butt. And that was right along the time that, my husband was on the beach with me, found the mass, he was tickling me, and, I ended up with breast cancer. That life, at that point in time, when you're seeing 20 to 30 people a day, you barely have time to scratch the surface on what's going on with their health. You are using the one main tool in the toolbox that you were trained to have as a means of treatment because you might not have any of the other tools available to you. Maybe you didn't study them. Maybe you haven't learned about them. Maybe you don't honor those types of practices. And for me, those prescriptions, that was part of the main toolbox I had. And when you're seeing that many people, you literally, it was just patient after patient after patient. Again, recipe for burnout. Obviously, I also had cancer brewing in my body. It wasn't the right way for me to live and practice. If I think about how people would ask me things, like patients would ask me things back then, patients who were curious, patients who, wanted to think outside the box, I probably would have dismissed them. I probably would have felt that way of just saying, like, let me stick to what I know. Let me not speak to what I don't. Let me just focus on this kind of medicine because this is how I've been trained.
And also, you don't even have the space to think about that, right? Like,
Exactly.
you're just like, I have friends who are oncologists and they're seeing patients where they barely have 10 minutes with them. And now the hospital setting is asking them that they need to even do more. How can you, with a cancer patient, and so, I've heard this time and time again, which is so interesting to me, that I don't have time for empathy. I have to just get to it, and they're still very empathetic in when they're talking to but they don't have time for that extra. And this is where, doctors, I feel like, take the brunt of it, even though it's not like doctors don't go into this field to necessarily be like, let me, turn this. They're in it for the healing, but then you enter a system that's a business model.
Yes. Yeah. Very quickly, once diagnosed with cancer, the oncologist, and I mentioned this story because it was really profound for me. She said, all right, Jacqueline, you've had a double mastectomy. You've had hormone suppressive medications. I did lose all my hair from chemo. You're welcome to go back to living the life that you did prior to when you got sick. And so she encouraged me to go back to living that way. And when you do that, and of course, when I took in what she said, that struck me so deeply because I realized that when you have a double mastectomy, at that point, if you go back to living that life, that 20 to 30 patients 5 days a week plus the weekends, this is a recipe for disaster, for metastatic cancer, for something else even more traumatic that would really eat me alive. And that point, leaving her office, was really the crux to be like, this has got to change. I can't live this way. I'm not going to heal people this way. I have to figure out another way to support myself, to support my family, that's going to speak to me, to make me feel really good. Let me learn. And that's where the curiosity kind of took the course. So you mentioned how, unfortunately, some providers, they don't have that extra time. That's where the magic is.
Right.
That is where you really get to know somebody at a deeper level. That's where you ask curious questions and you're brainstorming together. You're reflecting back on their life and you're thinking about how things happened and when they happened and when was the last time that you actually did feel really good. And maybe that was 5 years ago, 10 years ago, et cetera. So, I really struggle because that used to be me. I used to be practicing that way where I felt a little bit ignorant. I felt very much stay in your lane kind of medicine of, practicing in a way that unfortunately was not the best for me. And it took that cancer experience to make me realize that I needed to do something different. When you're a doctor who wants to think differently, when you start Google searching, and we're talking years ago now, but when you start Google searching and you're looking to other ways of healing, then you're looking at holistic medicine, whole body medicine. I don't know why there's, to me, whole body medicine.
It makes sense.
It
just does.
And then you learn about functional and integrative medicine. What I loved about functional medicine was when you think about root cause of diseases, we do know that if you take away the silos of medicine, inflammation at its most naked, vulnerable point is what really creates and causes virtually all disease states. And if that is a root cause, let us acknowledge that.
Right.
Why can't we acknowledge it? Why do we have to silo it? When I learned about functional medicine, I spent a year to 2 years post cancer experience. And at that point in time, I realized that there was so much more to learn than I even thought possible. You go through medical school, you are also through residency, and then you're like, okay, wow, there's still more. There's still so much more. And even now, I still feel that way. And I think that's what keeps inspiring me, is that there's always so much to learn and so much to evolve to know. That world is very much, the world of functional integrative medicine is very open. It is very vulnerable. Many of us come to practice that kind of medicine because of our own personal health experiences or experiences of those we love. It is very much this open way of thinking. At the very root of it, it is just how can we learn to understand the root cause of why people get sick? That is functional medicine. And integrative medicine is integrating all of these different types of approaches and modalities to heal and respecting them and honoring them and finding value in them. So when people tell me, and I just had somebody tell me last week, that they come across doctors who are not open-minded, who are going to poo-poo or call things woo-woo or whatever they may be to, add some sort of like negative connotation to the patient's curiosity to heal, find a new doctor.
Yeah.
Let's all work together and welcome all of the different ways that people can support healing. And I hate that. It makes me sad, and I think I'm a little disappointed that that's where certain aspects of the profession are. But I do know that as somebody who used to practice that way several years ago, it comes from a place of fear, of not knowing, of feeling like I just need to stay in this one bucket, in this one lane. These are the tools that I know. But when you open up your mind to realize that so many people are healing from so many different kinds of ways of talking to other providers that practice more functional or integrative minded, then there's nothing that you can do except to open the door and welcome that, because it is here to stay. It's not going anywhere. It's just more a matter of us collectively realizing that we're all here for the same goal so that people can get better.
Yeah. I mean, so many things that you just said. In that, as we're moving more and more, of course, I always feel like anything with health starts in the West Coast and then moves east, right?
Yeah.
But with the things that you're doing now, like at Love.Life, and, when you're looking at that from a holistic place, like the biohacking and the food and the nutrition and your sleep hygiene, all of these things that are interconnected with each other. I know, and I was mentioning this to you before we started, is that I had an intense amount of burnout that I just experienced for 3 months, and to the point where anything that I ate, I would immediately have sharp pains. And immediately, I was scared to eat anything because of the sharp pains. And then I was, my sleep was getting messed up. There's so many things happening. But the minute my burnout finished, my stomach's a little bit better, and it just shows like the root of like your anxiety, like everything. It starts at the gut, and it starts there. So as people are kind of coming to you now, and as you're at, Love.Life, and you're looking at, first of all, I'd love for everyone to know like about Love.Life and just about what is it that is making this so different than other providers?
Yeah. I'll tell you about why I decided to work for them, because I think that will explain a little bit more. When I came across the opportunity, something that really struck me was, number one, it was founded by the founders and executives at Whole Foods.
Right.
Whole Foods, around for 40, 50 years. And John Mackey sold it, I think maybe roughly 2018. He stayed on board until 2022. What he did, and if you've read his most recent book, The Whole Story, what he did was revolutionize the way that we eat and the way that we think about food. And I've come to appreciate Whole Foods in a very different way than when I just used to walk into a grocery store. Now I really do think about it in a very different way. So if you haven't read his book, it's a really great book to really understand the raw whole story. It's called The Whole Story. When I learned about what his vision was and Betsy Foster's vision was for Love.Life, they envisioned a beautiful sanctuary, a beautiful ecosystem where people could engage in recovery, nourishing foods, marrying the foundations of traditional medical care along with the layers of functional and integrative medicine with more than 20 experts in-house. They wanted to bring in tools that are in the biohacking world that do support healing modalities. They wanted to bring in the best of fitness and recovery and put it all under one roof. Mm-hmm. The idea of taking something big like that expansive and that large at scale was exciting but intimidating. But as a physician, I wanted to take a leap to practice in a way that felt really good. And for several years, I felt a sense of stagnancy that I wanted to grow from. When you practice at Love.Life, imagine a room where you have multiple practitioners, Eastern medicine practitioners, integrative doctor, a health coach, a registered dietitian, sports dietitians, personal trainers, physical therapists, a chiropractor, a traditional Chinese medicine doctor, an herbalist, an energetic practitioner, all talking about the same patient.
Yeah. That'd be a dream.
We get rid of siloed care.
Right.
And we focus on all of these foundations and this immersive pot, this soup of healing. And we're sharing ideas. We're brainstorming together. We're talking about cases during rounds, which we have every week. Wow. And we're melding together this experience. It's like nothing else I've ever seen.
Yeah. It's truly holistic.
Yeah. And so that's what really spoke to me. I was also pregnant with my son. And so, of course, taking a leap for this opportunity meant, okay, I'm kind of like birthing this beautiful experience for people, but at the same time, I also just had a baby. I needed to take time to rest. I took several months off while they had the grand opening. And now coming back into Love.Life and seeing how all of our practitioners do talk amongst each other and how we are sharing ideas and collaborating on cases, that is the dream. We talk about the silo of medicine. It's no longer in the foundational chronic disease care that we're providing or the care for people that are focused on longevity or the multiple disease conditions. For those patients who are looking for this, right? Some people still like that experience of that siloed medicine, and I'm not speaking to them.
Yeah.
I'm speaking to the ones that want this care team that is working all together to provide that kind of care. And to bring the concepts between functional integrative medicine to a space like Love.Life in a plaza with a Whole Foods, one store over, is really taking it more mainstream. We're opening up our doors to a community that is looking for this kind of care.
Right, and is ready for it.
And is ready for it, exactly.
Yeah. And I do find that, the path typically to here is you try the traditional way, it's not working. I know I've had doctors where with like hypothyroid and everything will be like, well, your blood panels, everything's balanced. So they dismiss the symptoms or they say, well, that's just part of it, and it's like, no, this can't only be the answer. And it just, you start then paying attention, as you mentioned, to like get curious. What else is out there?
Yep.
And you go to this. And, I always find that like, even when you were talking about your previous like work life where you're working 5 days, weekends, all this stuff, so much of the way that people function or think about, for example, like coming to a holistic space, I feel like it's because of just like, what our American culture is the hustle culture. It's the corporate life. It's the, if you're not working harder. I've had friends who are in the healthcare space and they get upset when they get sick because that means then they can't go into work. And that means then their workload becomes more. They feel bad because some other doctor now has to take on their workload and they know how everyone's just burnt out. So the fact that a doctor can't take time off and has to work through a flu, or is finding ways to do that.
Yes.
I mean, that speaks so much again to like the undervalues that's just ingrained in us as humans here in America.
Yes.
So with Love.Life and with, other types of experiences that are like that, people are kind of embracing more and more of that functional space. But I do think there's so much connectedness to, if we really want to see a shift in people looking at medicine this way, we also have to look a shift in our culture.
100%. That experience that you just described about a physician feeling guilty because they had to take some time off to support their health, I feel like I have a colleague who texted me about that last week.
Yeah. It's such an oxymoron, right?
It's really frustrating.
Yeah.
But, when doctors speak up to say something about that, when they're thinking about the system, that system was probably not designed to support their own well-being and healing.
Yeah.
It just wasn't. The practitioners who are having to deal with that guilt and that shame and that feeling, 150% they should not have it. But the system was kind of set up for them to feel as though they're booked out 2 months. They can't take time off because if they do, those patients need a place to go. It's going to swallow up their schedules for the following months. And then a vicious cycle creates even more burnout. Yeah. You take 1 day off, but then you're going to work 2 days for it.
Yeah.
And that's everywhere. Yeah. We do need to challenge that part of the system. We have to speak up. We have to support our own well-being because ultimately when you go to the doctor and you think about that doctor, does that doctor seem well to you?
Right.
How's the energy in the room?
Yeah.
Do they feel like they're taking care? Do they feel super rushed? Do they feel like they have 1 foot out the door? Mm-hmm. Is there an assistant in the room who's literally, taking over the whole conversation while they're there for 5 minutes? But healthcare in America needs this shift. We have to take care of our people who are going to support everybody else. And I can't wait to see more and more companies embrace that. Yeah. It's not enough, but the more that we talk about it and we bring it up and we say, look, this is a problem. Our doctors are feeling sick. They're overwhelmed. They're burnt out. They're feeling awful. Sooner or later, the more and more of us that speak out, change will happen. Yeah. I am grateful. I work in a place that honors and respects my boundaries, that loves my capabilities, that is very, very supportive of what time I need, even during that pregnancy, right? Just as they had a beautiful, incredible grand opening in South Bay, I wasn't there, but they wanted to respect the time that I needed to help support getting things off the ground with my baby.
While at a traditional place, there would be so much fear.
Oh, yeah.
And so much of like, how could you choose this? Like, how loyal are you? How invested are you truly in this if you're not here?
Yes. And, giving me the time and the space that I needed, that also felt so good that I felt valued in that way. And when it comes to seeing patients, I have a lot of autonomy in the sense that how many patients I see and when I see them, how much time I get to spend with them, not capping on messages that happen in between. Like all of these little things add up to make me feel really proud and grateful that I work for a place that honors and respects that. Yeah. We are revolutionizing healthcare in a very different way. There aren't practices like ours out there that want to blend the Eastern and Western world in this capacity that also support the recovery, the fitness, the nourishing meals, et cetera. And the fact that John envisioned this kind of environment years ago and seeing it come to life, I'm just grateful to be a part of it.
Hi, so I'm pausing the episode for a quick moment and for a quick favor. If you haven't already, if you could just click subscribe, leave a review wherever you're listening to this episode, it would be really helpful. The only way we can know to make sure that we provide the right type of podcast episodes, the right type of guests, and to make sure that we're delivering the type of content that you actually want to hear, it's through your reviews and through your support. Thanks, and now back to the episode. You touched on this earlier, but it's like, it doesn't have to be this all or nothing approach.
No.
It's like we can work together. We can figure out something, and every patient's so different. I'd love to learn from you, like just your own personal experience, like after you shifted, like what did you notice as a shift in your health, your transformation of your life after you made that very clear decision of how you're going to live, how you're not going to go back to the way things were? What would you say has been the biggest part where like, wow, this really works?
Yeah. Great question. So I think what happened was the more that I learned about functional integrative medicine, I used myself as the guinea pig. And at that point, I was in my most vulnerable state. I got down to like 108 pounds, was very frail and weak. Post chemo, hair is gone, very shameful and embarrassed to even go out. I didn't feel good. And then when you're on hormone suppressive medication, imagine being in your early 30s going through menopause. Not cool. The more that I learned, I realized that there were a few really important things about me that I had to think about in terms of why cancer happened. Number one, I had a childhood trauma. Childhood trauma that was never unpacked, that was never discussed, that was never processed, that I didn't have time to grieve, to forgive myself, to, talk about it with a professional. So I needed to unpack that. The second was learning about how my body metabolized hormones. And being very well versed in the hormone space, when I was practicing more in the concierge world, I focused a lot on stress, focused a lot on the adrenals. What you learn in functional medicine is this interconnectedness between all the hormones, and how, since your body is constantly outputting hormones in different locations that exhibit different things, it was important to understand it at that level, that macroscopic level. I learned that my body didn't metabolize estrogen well. There are certain genetic markers that were involved. There is liver metabolism that's involved. There is a dysbiotic gut microbiome where bad bacteria was overtaking a lot of the good stuff that was in my gut. And when I realized that, I really had to focus, just like you mentioned earlier, it all starts in the gut. I had to go back to healing the gut. We also know that the gut is where 70-80% of the immune system lies. We know that certain hormones and neurotransmitters that communicate to the brain happen here before they even communicate those signals. We also know that that very delicate nervous system also has direct correlation to the brain, which is why a lot of times we feel symptoms here when we're anxious or nervous or burnt out. And once I learned that, I did a gut stool test. I realized that there was a lot of imbalances in my gut microbiome. I focused on a gut healing protocol as a first step, and also focused on changing the way that I ate little by little. So, making a list, doing a food diary, circling, making highlights of examples of where I could make improvements. And it takes
Looking at the
that.
data.
Yeah, you kind of have to rip off the Band-Aid, take out a piece of paper, and start writing and visualize for yourself so that you can really see it. Because sometimes you can't see it in here without seeing it on paper, and I'm like that. Yeah. So I had to put down a couple weeks of a food diary and be like, okay, wow, look at what you ate at this time. Let me circle that. Where can I make some improvements? So I needed to make the improvements in how I ate, what time I ate, in addition to supporting my gut healing. And I knew that the way that that was going to support my body was it's going to help my immune system. My immune system is very much compromised post-cancer. I need to focus on creating a better biodiversity of all the bacteria that need to live in my gut, not so high of all the bad stuff. How can I do that? I needed to focus on decreasing inflammation, because if I can decrease inflammation here, then I can decrease it everywhere else in my body. I need to focus on the way that my brain is collecting and grabbing these signals from the gut. And how can I do that? By, again, focusing here. So this really was more of a cornerstone. What you learn through labs and testing, you learn that body is deficient in nutrients, that there are subtle signs of inflammation, that blood sugar being dysregulated happens far before somebody is diagnosed with diabetes, even before prediabetes. Wow. You can already start to see signs of this when you take a step back and look at the way somebody's lifestyle and diet is, and also looking at blood markers. I also realized that my path to healing wasn't going to look like anyone else's. So I needed to remind myself that unique to my own makeup was poor estrogen metabolism, a messed up gut microbiome, nutrients that were deficient, hormone signaling that had really just been burnt out and wasn't really communicating properly to the brain the way that it needed to. My sleep was a mess. Lots of things. Stress was not under control. Then I had this childhood experience that I needed to process.
Right.
And when you put all of those pieces together, there are very few practitioners at that time who really understood it in that way. And so I needed to find safety in where I could learn from practitioners in that space. That's where the world of functional integrative medicine welcomed that opportunity. And for me, it was, okay, where do I start? How can I start? Number one, let me focus on my sleep.
Yeah.
You have to get enough restorative healing during sleep, during naps, especially me post-cancer. I really needed to at least hone that in. And once I can get my circadian rhythm to really align, that would be the start to my healing journey. Interestingly enough, in the world of integrative oncology, we use melatonin to support healing from cancer. And most clinicians in that space, they will even prescribe for short amounts of time really high doses of melatonin because these individuals are very much depleted of that. What that meant was I needed to sleep at the right time of night and I needed to be outdoors at the right time of day.
Right.
Not just sleeping at night and then being in a room under artificial lights, but also embracing being outdoors, picnics, walks, literally breath work outside, embracing the sunlight, watching the sunrise and sunset when I can, because that shift in my circadian rhythm to light versus darkness was also going to align my body the way that my brain was going to communicate signals to the rest of my body. That sleep was number one, and I've always protected that.
So many things again. The biggest thing that was coming up for me is I think naturally people always think that in order to solve some of these bigger problems, it has to be a complicated solution, right?
Yeah.
And especially ambitious people, right? Like I know this about myself. Like if it's simple, it's like it can't be that simple. I'm like immediate dismissal because it's like it's got to be something so much more intellectual and complicated in order to solve this. And it's like no, like we may have advanced in technology, but our bodies take a lot longer to evolve. And that basic sleep right there, sleeping at the right time, making sure that your different organs at the hour that they're doing their cleansing process, you're sleeping so they can do its job.
Right.
Otherwise you miss that, it's something I learned from you. And, but I think it's so hard for people because again, it's that complication thing, but what you just did right there, it's like, just like anything, if you want to shift your, diet, you want to shift your fitness, you want to shift anything, it comes back to data. Mm-hmm. And what you just presented was so much data of like what we have. So anyone who calls us woo-woo, it's not like you literally just presented so much in that. Something that I'm curious about is there's all this incredible work that is happening. And a lot of doctors, like we talked about, are moving into that concierge service spaces because of the burnout, because they're not able to take care of patients the way that they want to take care of. And because they want to be more aligned with their values of what matters, patient care, getting to the root cause, all of these things. Mm-hmm. So 2 questions for you with this. First one is that part of that is concierge is expensive. It's not easy for it to be accessible for everyone. Mm-hmm. So how do people who can't necessarily, get that kind of service and get that kind of support, what can they do to just be able to like sometimes because even if they go to their own regular doctors and start talking about this stuff, the doctor's going to roll their eyes and be like, oh, because they're probably thinking more work on me, right? Mm-hmm. Because of the system, not because they genuinely don't necessarily care. Mm-hmm. What can someone who can't have access to this world do?
It is a hard question.
Yeah.
And I wish I had a magic wand to give the perfect answer, but I don't. I think that many physicians are wanting to take back their power and take back that autonomy, literally take back their power to be able to practice in a way that makes them feel really good, that inspires them, that doesn't make them see patients every 10 to 15 minutes. And the more and more that patients go to their doctors and continue to stay curious and ask questions about the blood work and ask about certain tests and ask about what symptoms, they still are experiencing, I think that we have a problem that doesn't quite have a solution just yet.
Right.
But it needs to. And the more and more of us that are pretty much in this paradigm shift of practicing this way, we're literally, every time you see a doctor who has transitioned into that space of private practice or concierge care, that's literally them waving their flag to say, look, I don't want to live and practice in a way that doesn't feel aligned with me. Mm-hmm. And they are consciously taking that step to stay aligned with who they are.
Yeah.
And I have to respect that.
Yeah. I really respect that. I love that reframe because I'm thinking I used to be a clinical therapist and I worked in nonprofit setting, was doing home-based counseling, all this stuff, right? And even in this burnout phase that I was in, I was talking to a few other, social impact change makers. And I've had friends who were doing work like literally in the war zones, right? For years and years and years. And now they've completely left it and they are doing work in a much more quieter way. And I look at that as like, a spectrum of like, you've got people who thrive in different sectors of the work. And similarly, so it's like everyone's kind of pulling that thread towards ultimately that road, right? Like, could I go work in that same type of way that I did when I was in my 20s? No. Like now, if I was to practice again as a therapist, I'd open a private practice. And it's looking at you're supporting people at different phases of their world, right? And just like anything, I mean, this is still, I would say, pioneering and in that space. And just like anything, the more doctors start moving this way, the more services come out, the more that will become accessible.
Right. And what I'd say is many clinicians have created other ways for people to still be supported, even if they might not be a direct patient.
Yeah.
Like, for example, certain companies, they'll, blogs, people write about it. They include evidence-based medicine right there in certain articles. They have community gatherings. Love.Life actually has a built-in community space that has about 50 people right off of where the restaurant is. We designed that on purpose so that we could bring in the community and have teaching opportunities and bring in guest speakers so that we can literally engage with the community. You don't have to be a member to be able to, participate in those kinds of opportunities. We've welcomed and we will welcome everyone to those kinds of events. People have created brands and their own social media followings that are dedicated to different kinds of wellness education that can support everyone and anyone. And I find that to be really valuable. Where I think people can get overwhelmed is when you open up the door on your social media to everybody and everything.
And then it's like, who do you trust?
Right.
With
Intuitively, think about what this person is saying and does that feel right to you? I encourage people to only click the notifications for the ones that really resonate well with you instead of doom scrolling over and over again and just seeing the barrage of everything because that, again, it's a recipe for disaster. But if there are certain people that you follow that you really intuitively feel called to because you love the education they're providing, those are the gems and the bits and pieces that are going to get put out into the world and also for your ears and your eyes to see.
Right.
And I think that's where there's also opportunity. You're right, where a lot of people are like, it can't be that simple, that it's stress management, that it's sleep, that it's hydration, that it's,
starting the morning with looking into the sun.
Yeah, but then you have to question yourself and say, can it? Can it be that simple?
Like if the things you've been doing hasn't been working, then just give it a shot.
Right.
Like just give it a month. Give it a little bit of time before you discredit something.
Right. What do they say? It's like 20, 21 days to create a habit.
Right.
So at least doing it for that long to see intuitively how you feel.
Yeah.
And for even the naysayers and the ones who are like, no, it can't be that simple. There's other answers. Try it.
Yeah.
Try it for yourself with an open mind and with an open heart. Focus on the way that you sleep.
Yeah.
Make sure you're hydrating every day. Walk outside and spend at least an hour outdoors every day, if not more. Watch the sunset, take a walk after dinner, see how you feel.
Yeah.
And that is actually the start to it. When you learn about functional medicine underneath that, there is so much healing to doing those types of things from a lifestyle perspective that are correlated to physiology. But we just don't talk about it in that way, right? So when we think about it and you're trying to explain it to patients, you're like, okay, sleep to support rest and recovery. And underneath it, this is melatonin hormone supporting healing, getting rid of dead cells, supporting regeneration, kind of taking out the trash, like all sorts of things. And you find that it can be that simple. Yeah. It can be the way that you're eating. It can easily be what your lifestyle is like. That is more than half the battle.
Yeah, I always go back to anything that we're doing, it's, again, an ingrained belief. And so if we want to actually shift the way we think about our bodies, I also look at it as like building a relationship with your body. So when I think about my thyroid or when I think about the organs that I'm healing, it's like I literally visualize, like I literally went on, I'm like, let me look at like, what does a thyroid look like first? And like actually visualize it. And, even now I find myself, it's silly, but when I'm eating something, I'm literally like, thank you. Like, I'm like, hey, I got you. Right?
Oh, I love that.
And so because when I eat something bad, I'm like, wow, I'm hurting you, which is essentially hurting me.
Yeah.
And so it's like, would I treat a friend this way?
Yeah.
Would I treat, somebody else in this path, right? And I wouldn't. And so it's really looking at it from that place where anything I do now, I actually ask it like, hey, like, you good with this? Like, I literally, like, in my head, I just like have that conversation.
I love that. When you put that kind of intention into what you eat, it's doing that much more. So if you think about mind body medicine, if we literally eat each meal with intention, you are already changing the way that that food is going to get received by your body.
Yeah.
And that is an important step to make. So when people talk about gut health, sometimes they'll automatically go to eat fiber, you need prebiotics, you need probiotic foods, all of this stuff. But at the end of the day, if you literally eat your food with intention and ask yourself the same questions that you just did in terms of, is this nourishing my body or is this harming my body? You are already going to apply just like almost, I would say, 100 times the effect of that nourishing food in your body because of the way that you've already put your magic on it.
Yeah.
You've literally sprinkled it with magic.
Yay.
Yeah, yeah.
Well, I could go on talking to you forever about this, and I can tell how much you care about this. So, first of all, having had you as my doctor in the past, this has been such an honor. And I want to just leave it with one question for you, that if there is one thing that you could just tell everyone to just reframe their relationship with their health, what would that one reframe be?
That one reframe would be to stay curious. Don't let traditional medicine or conventional doctors, silo you or gaslight you or put you into a space where your curiosity is downplayed. If you want to learn more about your body, if you're curious about why you still have symptoms, I would say to encourage more of that curiosity. There are lots of communities and lots of knowledge out there to be had in a way that feels really good to you. So if that is you, make sure that you stay curious about your body because that's what we should be celebrating. It's important for us to celebrate that. We shouldn't be in a place from a physician standpoint where you let people go after a doctor's appointment and they still have questions, they still have symptoms, they're still curious about answers, and you kind of just dismiss them. I feel like we should honor and celebrate that curiosity because that means you care. If you're a patient who has that kind of curiosity, it's because you care that much about your body. And those are the patients that are going to find the practitioners that really understand that.
Yeah. Thank you so much.
You're welcome.
Loved having you, and I can't wait to have you back for more, conversations because I know everyone's going to have a lot. And obviously they can find you at Love.Life and,
Yes.
and you're pretty active on socials as well. So I know if they want to reach out, they could.
100%. We have open community meet and greets. So that's pretty much every Wednesday and Saturday for people to meet members of our care team, to get to know them. We also have community events. You can follow us on social at Dr. Jaclyn Tolentino at the official Love.Life. And I can't wait for you to come in.
Yeah, I know. I'm excited to check it out. So thank you again.
You're welcome.
I really hope that you enjoy this episode. And I just have one favor to ask you. If you could just make sure to hit that subscribe button, leave a rating and review, it's going to help us tremendously to make sure that we reach as many people as possible that you think should be listening to our episodes. I'll see you next week for another episode, and thank you so much for leaving that one review, that one subscription, and sharing this with your friends.